Are you taking care of your penis in the morning the way you should? Most men aren't. And by the time they realize it, problems have already started. Low energy, weaker erections, and quiet changes in function they never expected. I'm Dr. Justin Keller, a urologist. In this video, I'll walk you through 6 essential steps every man over 60 should take first thing in the morning to protect circulation, preserve hormone health, and prevent the most common issues I see in my practice. We'll talk about why missing morning erections could be the first warning sign, the right way to clean yourself, and what most men do wrong, what your morning urination says about your prostate, the silent habits that kill testosterone before breakfast. This isn't fluff. These are real clinical insights based on what I see every day treating men just like you. Stick around to the end, because the very first habit we'll cover is the most important and the one I see ignored most often. It might surprise you. And while you're here, drop your city in the comments. Let me know where you're watching from. It helps me understand who I'm reaching. If you want more real, useful advice for staying sharp, strong, and independent as you age, hit the like button and subscribe to Glowing Age. That support helps me keep creating these lessons. Check for morning erections and what it means if you don't have one. If you've stopped waking up with morning erections, don't ignore it. That quiet change is one of the earliest and most reliable signs that something deeper is happening in your body, specifically with your blood vessels, hormones, or nervous system. It's not about libido, it's about circulation and health. As a urologist, I can tell you this is often one of the first things to fade, and also one of the most overlooked. Men in their 60s, 70s, even 80s will say, "It's just age." But that's not the full story. Morning erections aren't optional. They're your body's way of showing that blood flow, testosterone, and neurological function are all still working the way they should. Let's talk physiology for a moment. During REM sleep, deep restorative sleep, your body triggers spontaneous erections, typically 3 to 5 times per night. These are not sexual in nature. They're maintenance events. Just like your heart beats and your lungs breathe, your penis needs regular blood flow to stay healthy. Think of it like this: if a muscle doesn't get oxygen and blood on a regular basis, it weakens. Tissue begins to atrophy. Over time, function declines. Your penis works the same way. When you wake up without a morning erection consistently, especially if that's a new change, it may be a sign of declining testosterone, impaired circulation, early diabetes, or even silent cardiovascular disease. In fact, several large studies have shown that erectile dysfunction can predict heart disease before any other symptom appears. That's how closely connected your vascular system is to your sexual function. Now, does this mean if you miss a day or two, there's a crisis? No. Hormone levels fluctuate, sleep patterns vary, and stress plays a role. But if you're no longer noticing regular firmness in the morning, especially if your sleep is good, that's worth paying attention to. And it's something I ask my older male patients about all the time, quietly, directly, and without embarrassment, because it tells me more about your health than a blood pressure cuff or lab test ever could. Let me give you a real example. A man in his late 60s came to see me not for erectile dysfunction, but for low energy and mental fog. He hadn't even realized that his morning erections had disappeared over the past year. He just chalked it up to age. But when I asked, he stopped and thought. "You know," he said, "I can't remember the last time I had one." We checked his labs. His testosterone was low, but what concerned me more were his lipid levels and fasting glucose. Pre-diabetic elevated triglycerides, borderline high blood pressure. He wasn't feeling symptoms yet, but internally the changes had already started. That missing erection, it was his early warning sign. We adjusted his lifestyle, better breakfast choices, some light strength training, improved sleep. His morning erections returned within 2 months, and his labs, all trending in the right direction. This is why I say, don't wait until there's a crisis. Your body whispers before it screams. Waking up without an erection isn't about masculinity. It's about circulation, hormones, and early detection. It's your body's report card, delivered daily, if you're paying attention. So when you wake up tomorrow, take a moment, not out of worry, but out of awareness. Track the pattern, know what's normal for you, and if that normal starts to change, don't ignore it. Because the earlier you catch it, the easier it is to do something about it. Clean properly, but gently. Too many men either overdo hygiene or ignore it altogether, and both extremes can lead to serious problems, especially as you get older. The penis is a delicate structure with sensitive skin, and after 60, it becomes even more vulnerable to irritation, infection, and inflammation. How you clean it each morning can either protect you or quietly harm you. Every morning, your body wakes up not just from sleep, but from several hours of heat, moisture, and friction inside your underwear. Sweat, dead skin cells, and natural oils accumulate overnight. If left unchecked, this creates the perfect breeding ground for bacteria and fungi. And if you're uncircumcised, that risk is even higher, especially if you're not retracting the foreskin fully and cleaning underneath. But here's the catch. Harsh soaps, scrubbing too aggressively, or using hot water can do just as much damage. I see men all the time who develop chronic irritation, itching, or redness, not because they're neglecting hygiene, but because they're overdoing it. The penile skin is not built for antibacterial soaps, body wash with fragrance, or rough cloths. Here's how to do it right. Start with lukewarm water, not hot. Hot water strips the skin's natural protective oils, leaving it dry and prone to cracking. That creates microtears, which invite bacteria and increase the risk of infection. You don't need a fancy cleanser. In fact, for most men, plain water or a gentle, unscented cleanser designed for sensitive skin is more than enough. If you're uncircumcised, you must retract the foreskin completely, rinse under it gently, then dry the area carefully before pulling the skin back. This is essential. I can't count the number of cases I've treated men in their 60s and 70s who developed balanitis, a painful inflammation of the glands, simply because they didn't clean underneath the foreskin regularly. Over time, that can even lead to scar tissue, tightening of the foreskin, and problems with retraction, what we call phimosis. If you're circumcised, you still need to clean thoroughly, but be mindful of the skin at the base and underside, especially near the scrotum. That area is often neglected and can trap sweat and debris, especially if you've been sleeping warm or if you're carrying a bit of extra weight around the waist. And don't forget to dry thoroughly. Moisture is a breeding ground for fungi, especially in older men with reduced skin elasticity. I recommend a soft towel, dab, don't rub. Make sure the area is fully dry before you dress. Now you might be thinking, I've never had a problem before, why start now? Here's why. As we age, our immune response weakens, skin becomes thinner, and healing slows down. What you could get away with at 40 might lead to chronic irritation at 70. I've had patients who ended up with recurrent infections or even minor skin breakdowns simply from poor hygiene habits or using the wrong soap. One of my patients, age 73, came in with what he thought was jock itch. It was irritation caused by years of using the same peppermint-scented body wash on his entire body, including his groin. His skin was inflamed and he had developed cracks at the base of the glands. All we did was simplify his routine. Switched to a gentle cleanser, taught him proper drying, and within 2 weeks everything cleared up. It's not about doing more. It's about doing the right things the right way. So tomorrow morning when you're washing up, slow down, be intentional. Use warm, not hot, water, a mild cleanser if needed, and be gentle. Your skin will thank you. And over time, so will your confidence, comfort, and overall urological health. Inspect for changes or irritation. If you're not taking a few seconds each morning to visually inspect your penis, you're missing one of the simplest and most effective habits for protecting your long-term health. I don't mean staring in the mirror for vanity. I'm talking about a quick clinical check, a personal scan. And for men over 60, this becomes more important than ever. As a urologist, I've seen countless cases where serious issues could have been caught early with a simple morning inspection. The truth is, most men don't look until something hurts. And by then, we're often dealing with infection, inflammation, or something that's been developing quietly for weeks or months. So what should you be looking for? Start with skin color. Any unusual redness, dark spots, or discoloration that wasn't there before. Make a mental note. Healthy penile skin should be consistent in tone. Sudden changes, especially if they come with itching, pain, or peeling, could point to infections, fungal, bacterial, or even early signs of skin cancer. And yes, men can get skin cancer on the penis, particularly in areas that have been chronically irritated, especially if hygiene hasn't been ideal. Next, check for sores or lesions. These can be easily missed, especially if they're small, painless, or located near the base or under the foreskin. I've diagnosed men in their 70s with STIs they didn't know they had because they assumed any irritation was just friction or dryness. Herpes, syphilis, and even HPV-related lesions can all appear subtly, and often go ignored because they're not painful. Then look for swelling or unusual lumps along the shaft at the base or inside the scrotum. While many lumps are harmless, some can indicate cysts, inflammation, or in rare cases, penile cancer or testicular abnormalities. A small, firm bump that doesn't go away over time needs evaluation. It may not hurt now, but if it's growing, it needs to be checked. Also, pay attention to discharge. Even a small amount of unusual fluid, especially if it has an odor or comes with a burning sensation, can indicate infection in the urethra or prostate. Don't assume it's nothing. A 30-second inspection could prevent weeks of discomfort or more serious complications. And don't forget the underside and the area where the shaft meets the scrotum. That's where irritation and fungal infections often hide, especially in warmer months or if you sweat at night. Men with diabetes are particularly prone to these infections, even if they're managing their blood sugar well. Let me tell you about a man I treated recently, 68, retired engineer. Sharp, responsible, very clean. But he came in with persistent redness and mild burning on the glands. He assumed it was from tight underwear. When I examined him, I found early signs of lichen sclerosis, a chronic skin condition that can scar the foreskin and restrict function. He'd been ignoring it for nearly a year. We caught it before permanent damage, but if he'd checked daily and come in sooner, treatment would have been easier and faster. You don't need to turn this into a ritual. Just 30 seconds after you clean and dry is enough. Make it a habit, like brushing your teeth or checking your blood pressure. Your penis is not separate from the rest of your health. It's connected to your hormones, your blood flow, your immune system, and your skin integrity. When something changes down there, your body is telling you something. And after 60, that message matters more than ever. Catch it early. Act early. That's how you protect what matters, not just for function, but for dignity, comfort, and peace of mind. Urinate fully and watch for signs. If you're rushing through your morning urination, especially after age 60, you might be ignoring one of the clearest indicators of your urinary and prostate health. And what seems like a small annoyance, like taking a little longer to go or a weak stream, could actually be your body's early warning sign. Here's what I want every man in his 60s, 70s, and beyond to understand. How you urinate first thing in the morning tells me more about your prostate and bladder function than you think. Let's start with what happens overnight. While you sleep, your body produces less urine and your bladder fills slowly. By morning, that pressure triggers your urge to empty. For a healthy urinary system, that first urination should be strong, steady, and complete. But for many older men, that process starts to change, and it's often brushed off as just aging. I hear it all the time. "Doc, I just get up a few times at night. It's normal for my age." No, it's common, but not always normal. Here's what to watch for. Weak stream. If your urine starts slow or dribbles, or if you need to push to get going, that can be a sign of an enlarged prostate, known as BPH, benign prostatic hyperplasia. The prostate surrounds the urethra, and as it grows with age, it can squeeze that pathway, reducing flow. This isn't just annoying. It can lead to bladder strain, urinary tract infections, and even kidney stress if ignored. Incomplete emptying. Ever feel like you just went but still need to go again? Or that your bladder didn't fully empty? That's a red flag. Incomplete emptying increases your risk of infections and bladder stones. If this happens frequently, it needs to be evaluated. A quick bladder ultrasound can reveal residual urine, something we use in clinic often with men over 60. Frequent urges or nighttime trips. Waking up more than once to urinate may be a sign of prostate enlargement, but it can also signal early signs of diabetes, bladder overactivity, or low testosterone. Yes, testosterone plays a role here too. It helps regulate smooth muscle tone in the bladder and urethra. Burning or discomfort. Pain while urinating should never be ignored, even if it's mild. It could mean infection, inflammation, or even early warning of prostate or bladder conditions. I've diagnosed prostate infections, urethritis, and even bladder cancer in patients who thought it was just a little irritation. I treated a man recently, 71, former contractor, strong guy, no major medical problems. He told me he'd been waking up twice a night to pee for about 6 months, thought nothing of it. But his stream had become slower and he was starting to feel tired in the mornings. We did a full workup. His prostate was enlarged and his PSA was elevated. A biopsy confirmed early-stage prostate cancer. Because we caught it early, his treatment was simple and highly successful. All because we looked deeper into what most would call just getting older. The key is this: don't normalize dysfunction. Just because a symptom is common doesn't mean it's harmless. Pay attention to the quality of your stream, the sensation of relief, and any new changes. And don't rush. Take an extra few seconds to ensure you've emptied completely. Sometimes I advise patients to stand, urinate, then wait 20 seconds and try again. That second release often clears residual urine. This daily check-in doesn't require tests, technology, or a doctor's visit. Just your attention. Every morning, your body gives you feedback on your prostate, your bladder, even your nervous system. Use it. Because when you catch changes early, you stay in control. You avoid complications, and you protect not just your function, but your independence. Support blood flow right away. The first hour after you wake up sets the tone for your entire circulatory system, including blood flow to the penis. And if you're over 60, how you treat your body in that window has a direct effect on your performance, energy, and long-term erectile health. Most men don't realize that poor morning circulation is one of the hidden drivers of declining function, even when everything else feels fine. Let me explain what I mean. Erections are not just about hormones or desire. They're a blood flow event. They depend on healthy, responsive blood vessels that can expand and carry oxygen-rich blood efficiently. As we age, those vessels naturally lose elasticity. Add to that a sedentary lifestyle or metabolic changes like prediabetes or high blood pressure, and the result is stiff, narrow vessels that struggle to do their job. You might not feel it yet, but your penis will be the first to notice. Now think about the typical morning for many older men. You wake up, sit on the edge of the bed for a while, maybe scroll through the phone, then head straight to the kitchen to sit again. That's 30 to 60 minutes of total stillness with poor circulation, low oxygen delivery, and minimal stimulation to the pelvic area. Over time, this becomes a pattern. And that pattern leads to one thing: atrophy. The tissues that don't get used don't get blood. And when that happens regularly, performance declines. Here's the fix, and it's simple. Within the first 15 minutes of waking up, get your body moving. No need for heavy workouts or complex routines. Just walk for 3 to 5 minutes, do light leg stretches, or even stand and perform a few squats or heel raises. Movements that activate your legs and hips boost blood flow to the pelvic region. That includes the arteries that supply your penis. Why does this work? Because motion wakes up your vascular system. It improves nitric oxide production, a molecule your body uses to dilate blood vessels. And better dilation equals better blood flow. This is the same mechanism behind many erectile dysfunction medications, but here you're activating it naturally. I had a patient, 67 years old, recently retired. He came in feeling low energy and said he hadn't had a spontaneous erection in nearly 6 months. He wasn't overweight. Labs were okay, but his mornings, totally sedentary. He'd sit in a recliner with coffee and TV for over an hour. We added one simple change: 10 minutes of light walking each morning. That's it. Within weeks, he noticed a return in morning erections and felt more mentally alert. Nothing magical, just better blood flow right away. And here's another factor: hydration. After 6 to 8 hours of sleep, your body wakes up slightly dehydrated. That means thicker blood, slower circulation, and reduced oxygen delivery. If the first thing you drink in the morning is coffee or tea, both of which are diuretics, you're dehydrating even more. Start with water, just a glass, before anything else. That alone helps your vascular system function better and supports healthier erections. In summary, move your body, hydrate early, and don't let your first hour of the day be one of total stillness. Your heart, brain, and yes, your penis rely on circulation that begins with simple, intentional choices. Every step, every stretch, every ounce of water is a signal to your body. Keep the blood flowing. And for men in their 60s and beyond, that's one of the most powerful forms of daily protection you have. Avoid morning habits that lower testosterone. Your testosterone is highest in the early morning. That's not a guess. It's a well-documented hormonal pattern. Testosterone production follows a daily rhythm, peaking shortly after you wake up and declining as the day goes on. But here's the problem. Most men unknowingly sabotage that peak within the first 30 minutes of their day. If you're over 60, you can't afford to waste those hormonal windows. Testosterone affects far more than just libido. It impacts energy, memory, mood, muscle tone, metabolism, and yes, erection quality. So if you're waking up and immediately falling into habits that suppress it, you're setting yourself up for a slow decline. Let's start with one of the biggest culprits, sugar. That glass of orange juice, sweetened cereal, or toast with jam might seem innocent, but they're powerful testosterone suppressors. Multiple studies have shown that even a single high-sugar meal can drop testosterone levels by up to 25% within 1 hour. And if this happens daily, at the exact time your levels are supposed to peak, you're flattening your natural rhythm. Over time, that leads to consistently low levels, even if your labs look normal. Then there's stress, which most men don't recognize in its early forms. Opening your phone first thing to check the news, emails, or financial updates. That mental jolt spikes cortisol, the stress hormone that directly competes with testosterone. Cortisol and testosterone can't both dominate at the same time. One goes up, the other goes down. And high morning cortisol, especially from digital stimulation, kills testosterone production before the day even begins. Another subtle mistake? Poor or disrupted sleep the night before. Sleep is when testosterone is produced. If you're waking up multiple times, not reaching deep REM, or cutting your sleep short, your testosterone suffers. And the older you get, the more fragile your hormonal balance becomes. I often tell my patients, you don't just lose testosterone because of age. You lose it because of years of interrupted sleep and overstimulated mornings. So what should you do instead? Start with sunlight. As soon as possible after waking, expose your eyes and skin to natural light. Morning sunlight helps reset your circadian rhythm and signals your body to reinforce healthy testosterone and cortisol timing. Just 5–10 minutes on your porch, balcony, or near a window is enough. Next, focus your first meal on blood sugar stability. Skip the juice, pastries, or processed carbs. Choose protein, healthy fat, and fiber. Eggs, avocado, nuts, or Greek yogurt are simple, effective options. They don't spike insulin and they support testosterone, not suppress it. Then try breathwork or stillness before reaching for your phone. Just 3 minutes of calm breathing can lower cortisol and boost parasympathetic tone. Your body's rest and repair mode. That state supports testosterone production, especially when practiced consistently. One of my patients, 70 years old, had been experiencing low motivation, less drive, and no longer felt sharp in the mornings. His labs showed mid-range testosterone, but I suspected rhythm disruption. He was waking up, grabbing his phone, checking stocks, then eating toast and jam. We changed his routine: early sunlight, no phone for the first 30 minutes, a protein-based breakfast, and brief movement. Within 4 weeks, he said he felt clearer, more engaged, and more alive. That's testosterone in action. No prescriptions, just rhythm correction. So here's the truth. Your morning is your hormone foundation. What you do in the first 60 minutes can either support or sabotage your testosterone for the rest of the day. If you want to protect your energy, your mood, and your performance, start by protecting your mornings. Because at this stage of life, small habits don't just matter, they define your health trajectory. These 6 morning habits aren't complicated, but they are essential. Most men wait until something goes wrong. But the men who age well, the ones who keep their strength, their function, and their confidence, are the ones who pay attention early. If you've been skipping any of these steps, now is the time to start. Your health is still in your hands. Small changes now can prevent bigger problems later. Let me know in the comments which of these you already do, and which one you're going to start tomorrow. And if this video helped you, give it a like. Subscribe to Glowing Age to support the channel, and so I can keep bringing you real, practical guidance you can use. Take care of yourself. I'll see you in the next one.